in furtherance of its effort to create meaningful opportunity for all as contained in the MORE agenda, which aligns with the renewed hope initiative of the federal government, especially in the area of good health, the wife of the Delta State Governor, Deaconess Tuboro Oboruwori, has flagged up a sensitization and measles rubella vaccine advocacy rollout in Delta State. The ceremony took place at the Unity Hall in the Government House in Asaba, the state capital. According to the First Lady, the goal of the exercise is to reduce cases of measles from 72% in Delta State to 95% as recommended by World Health Organization, as 10,000 children are born every year with congenital rubella syndrome, a complication of the sickness which is underreported by the media.
I'm excited to welcome you to this one-day sensitization on introduction of measles rubella vaccine as a routine vaccine in National Program Immunization. This initiative by the Nigeria Governors Crisis Forum is indeed a welcome development and quite commendable. The program is targeted at sensitizing mothers and caregivers to the efficacy of vaccines to prevent childhood diseases and to ensure that all children are given appropriate vaccines. The importance of this advocacy is to increase vaccine access and acceptability, particularly in the areas with low vaccination rates. This will eventually ensure a reduction in children suffering from measles rubella as well as complications arising from the disease, which includes blindness, brain damage, and death. But Odoyin told us about hole in the heart. We are here to know more about this rebellion. We can still do our research too on our own. The MORE agenda of this administration, under the leadership of our governor, my dear husband, is committed to the well-being of all Deltans, ensuring that childhood diseases and child mortality are reduced to the barest minimum through effective immunization. This is our chance to benefit from the laudable program to protect the health of our children, especially at the grassroots.
Deaconess Tuboro Oboruwori emphasized that the Oboruwori-led MORE administration is committed and ready to tap into the national program for the benefit of Deltans. She was also invested with the State Ambassador of Measles Rubella Vaccination Champion, as well as that of Net Ambassador by the Rollback Malaria in Nigeria. Rock Odeka of Center for Wellness and Integrated Nutrition Series, representative of Dr. Hussein Imosule, Delta State Coordinator of World Health Organization, and Courage Ibihode, UNICEF South-South Coordinator, in their various presentations, gave more insight into the Rollout advocacy campaign and its desired goals, as well as expected cooperation from all stakeholders.
The rollout of measles rubella vaccine is due to commence in October in the north this year and January in the south 2026, which will be administered to children as alluded to by our Honorable Commissioner, ages between 9 and 15 years of age, 9 months and 15 years of age. This range was chosen by government as they don't just want to protect them, but a whole generation. So they will be shielded from diseases such as the congenital rubella syndrome, CRS, which can occur in pregnancy, before, after birth.
But vaccine, no matter how effective, cannot deliver impact unless it reaches every child. This is where the power and importance of stakeholders come into focus. Ladies and gentlemen, the success of this campaign will be determined not just by the vaccine that we have in our coastal, but by the commitment of every stakeholders in this room and beyond. From the place to pulpit, from the community to town hall, to radio station, from classroom to market, every segment of the society must be mobilized. For our traditional leaders, they are the custodian of the community. Your endorsement and grassroots mobilization can open doors in ways that formal system cannot. For our religious leaders, your voices can bridge science and faith to encourage families to do the right thing for their children.
On behalf of UNICEF Port Harcourt Field Office, I want to extend our Women's greetings and heartfelt congratulations as we gather for this sensitization and flag off of Measles Rubella advocacy rollout in Delta states. This momentous occasion marks a significant step forward in our collective effort to protect the health and well-being of every children in Delta states. The partnership between governments and local communities and organizations like UNICEF is crucial in ensuring that every child receives the essential vaccination they need to grow healthy and thrive. Measles and rubella are serious diseases that can have devastating consequences if left unchecked. By this advocacy for vaccination and raising awareness, we are investing not just in the health of our children today, but in the future of our communities and the nation.
Earlier, the Delta State Commissioner for Health, Joseph Onojami, and Dr. Onyewelahi Owa Wabuzo, a resource person, gave details into the causative agent, mode of transmission and symptoms, as well as its resultant complications.
The measles and rubella are highly infectious viral disease. They are transmitted through respiratory droplets when an infected person coughs, sneezes. It can also be spread through direct contact with the nasal secretion from an infected person. While measles disease could result in serious complications like pneumonia, encephalitis, and even death, it is typically present with symptoms of high fever, cough, runny nose, difficulty with breathing, and a distinctive red rash. The disease is highly contagious, spread from person to person through aerosol from infected person. Non-vaccinated individuals nearby are at risk of becoming infected by this means. On the other hand, rubella disease is a milder illness, but it still poses substantial risk to pregnant women in particular. Infected pregnant women have been reported to transmit it to their unborn babies, who may present with congenital malformation like neural tube defect, microencephaly, as small head, and poor intelligence, heart defect, hearing impairment, and delayed developmental milestone. You see that if a child who is supposed to crawl at 6 months to delay to like 1 year, 6 months, this disease are vaccine preventable.
So the aim and objective of this campaign, first, is that we need to contribute to the reduction of measles and rubella incidence in Nigeria to at least 5 cases per million by 2026 and 1 case per million in 2030 by increasing population immunization through vaccination. Now, the first step is achieve 95% measles rubella vaccination post-campaign coverage among children aged 9 to 15 in all implementing states.
West Charles Kosipre reports that the chairpersons from the 25 local government areas of Delta State were also invested as local government ambassadors of measles rubella vaccination.
I want you people to take it serious, as I said. As from today, you people are being initiated into this campaign fully.